Hello, my name is Nabeel Obeid. I'm a minimally invasive and bariatric surgeon and general surgeon here at Michigan Medicine. I serve as vice chair for clinical operations for the Department of Surgery and chief of surgery at Chelsea Hospital. One of my top priorities when caring for patients is to make sure that they have a thorough understanding of the care that's going to be delivered to them, including a surgical procedure. And so I really want to take the time to answer questions that they have and review things, details related to the surgery. And then ultimately, we want to set them up for success with surgery to make sure that they're really as optimized as they can be going into surgery. So that may mean working with their specialist to address any medical conditions that could be affecting their surgery. Because ultimately, my job is to help patients and to make sure that they have as best of an outcome after surgery as possible. So partnering with them to ensure their success and that their post-operative recovery is as seamless as possible is my top priority. So in terms of pros and cons for bariatric surgery, I like to think that the pros far outweigh the cons. And the pros are that you take a dramatic step in improving your overall health, and that includes significant weight loss and improvement in medical conditions related to obesity and prevention of future medical problems. We focus a lot of the conversation on the benefits of the surgery, including how it can affect those medical conditions, improve them, or even contribute to them going in remission, and as well as prevention of future medical problems. And most patients are very good candidates for bariatric surgery. Bariatric surgery has come a long way over the last several decades. It is extremely safe, and we offer multiple different procedures for bariatric surgery. Just to put it into context, bariatric surgery procedures are as safe, if not safer, than routine surgery like gallbladder removals, hysterectomies, knee replacement surgeries. Oftentimes, patients or referring providers may have a misconception about the risks of bariatric surgery, but it's really quite safe. Every procedure has some potential risks, but putting in perspective, these are very, very safe operations that have profound impacts on people's health. I work very closely with providers from multiple different specialties, particularly in our bariatric surgery program. It truly is a multidisciplinary team. And the power of that is that we're leveraging everyone's expertise and also their compassion for the care that they're providing to really provide the highest level of surgical care for our patients. What makes me passionate about being a surgeon is delivering high quality surgical care to patients and seeing the success that they have after surgery. And particularly for bariatric surgery, it has such a profound impact on an individual's overall health, their improvements in their medical conditions, and prevention of future medical problems. And I've seen countless patients time and again describe what a difference it's made in their lives, and that gives me great satisfaction.